Is it possible for women to put their fertility on hold? Well, there are a couple of tech companies leading the way by offering more health benefits for women. Both Facebook and Apple will pay for employees to freeze their eggs, which can be an expensive perk for female employees who want to postpone motherhood. Now, this is according to an NBC News report. Experts say it's part of a push to attract more female employees. Apple also offers adoption and surrogacy assistance, as well as some other fertility benefits. And this idea of freezing your eggs, it is definitely trending recently. There are actually egg freezing parties that are popping up across the nation. Sometimes this is the latest thing for young women who are preparing for families, but preparing for them in the future. They get together, it's a fun setting, they have a few drinks as you see here, they learn about the process. The idea here is women can concentrate on their careers first, and then they can become mothers down the road. We're back here with Dr. Chantilis from Dallas-Fort Worth Fertility Associates. How much of a reality is that? I mean, how long can you put that off? A year, 2 years, 5 years, longer?
Well, in theory, you can put that off indefinitely. So, you know, once an egg or an embryo is frozen, you know, in theory, you could use it 20 years later. But from a practical sense, you know, if you're not using it within 5 to 10 years, you're probably not going to use those. But from a technology standpoint, they're good indefinitely. So yes, you can delay childbearing to you know, whatever age you think is reasonable.
Is it smart? I mean, do we just don't really have the track record of the science to show how long you can do it?
Well, it's still relatively young. So you know, but you know, there have been certainly embryos that have been frozen and thawed you know, over a decade and have had good outcomes. So egg freezing is still we're not quite there, but I have no doubt that the technology will show similar results once we have that.
So who is it best for? Who's best suited to go that route?
Well, that's a very good question. So and of course it's a little bit controversial, and so certainly you want to find women that are that have enough eggs to freeze. You know, one of the problems that we have is someone comes into our clinic and you know, they're over 40 years old, and at that point it's very difficult to even stimulate or potentially get eggs in some of these folks. Others, of course, have wonderful, robust ovaries over 40, so you have to individualize that. There's controversy, you know, should a young woman do this? You know, what if 22-year-old or 25-year-old, should she freeze her eggs? Well, you know, there's a good chance that she might not need that. You know, if she gets married, has a child on her own, so then potentially you're having to put someone at a potentially unnecessary medical procedure. But I'll frame that question best. I have twin daughters and who are very young, and someone asked this question to my wife, and my wife was like, "Absolutely, they're going to freeze their eggs just in the event." And of course, I'm the more cautious one. Is like, well, you know, is that the right thing to do? So it's and when would you have them do that? But
are we seeing mostly younger women do it? Is that who's really approaching it right now? Is it
not really?
No.
Not really. It's usually women in their mid-30s that haven't, you know, maybe they put their career first, and like many men and women today, but they haven't found someone, or I see it's interesting, but we see a lot of people that just broke off a long-term relationship, and now they're, you know, looking to preserve their fertility, and so a lot of times we'll see that as well.
How much would you say the popularity of this is growing?
How much? How would I determine that? You know,
how much are you seeing and people asking you about it?
We're getting more calls and more requests. You know, 2 years ago, very few requests. A year ago, we see several a month. You know, so it's available. It's certainly more popular. You hear about it in the news. You read it in the print in places like California, New York. That's very popular, and that trend is spreading to even Texas. So we're certainly seeing it more and more.
How much of an investment is this?
Depends, of course, on where you live and so forth, and which perhaps clinic you go to. But generally speaking, it's about $10,000, of which $3,000 to $4,000 is medication cost.
You said earlier sometimes you're not sure if you want to go through the medical risk of doing this. So I'm not sure if you use the word risk, but if you want to go through a procedure of doing this, is there any risk involved or something you need to consider physically?
Well, there's low risk, of course. Ovarian hyperstimulation, bleeding, infection. These are very uncommon risks, but it's not zero. And but it's a fairly safe procedure. But there's always some potential risk in any kind of medical procedure.
So if you have a patient who's thinking about it, what do you tell them? These are the things you need to consider and lay out before you decide to go down this road.
Yeah, certainly. Well, the first is, where are you today? What is your ovarian reserve? Do you have healthy, robust ovaries? Are they, towards the tail end of your reproductive lifespan? There are even 28-year-olds who don't have healthy ovaries, as an example. But that's the first thing, is where are you right now? And then secondly, then this is the $64,000 question, is, well, how many eggs do we need to freeze to give a reasonable chance of pregnancy? And there's not a final answer to that. And that's because most of the data that's been developed has been developed in younger egg donors, and these are women that have been selected. But generally, my counsel is that if they can freeze 15 to 20 eggs, and that may take more than one retrieval, but if they can do that, then you've got 2 to 3 realistic chances at conceiving with an IVF procedure in the future.
And then find the right clinic that's done this before and has some experience as well, right?
Well, ideally, yes, certainly.
Okay.
Of course, yes.
Doctor, thank you so much for being here today. Very good information on a very complex subject that's difficult to talk about for some people sometimes. Thank you. If you have questions about infertility, you can reach the doctors there on their website. There it is right there on the screen, dallasfertility.com. And that is our time for now, but we want you to stay plugged into DFW. If you missed any of the information in this show, or any other Plugged Into DFW show for that matter, you can always go to our website to find out more. It is txa21cares.com. We'd like to hear from you too. If you have a community issue or concern, send us an email. Our address right there, pluggedintodfw@cbs.com. Thanks for being with us today. We will see you next week. Until then, I'm Jason Allen, reminding you to stay plugged in to DFW.